Today we have the privilege of speaking with Dr. Sashi Kuppala, a dedicated neonatologist based in Louisville, Kentucky. With an impressive background in neonatal-perinatal medicine, Dr. Kuppala completed his residency at the Cleveland Clinic and his fellowship at Cincinnati Children's Hospital Medical Care. He holds a master's degree in healthcare quality and safety management and has contributed significantly to the field through his research and publications. Dr. Kuppala's work has had a profound impact on the care of premature infants, influencing guidelines and practices not just in the United States but worldwide. Today we'll delve into his experiences, insights, and the challenges in neonatal care. Welcome, Dr. Kuppala.
Thank you. Thank you for having me today.
Of course, our pleasure. What inspired you to pursue this field, and how do you keep the interest and the motivation going?
So, neonatology means like newborn medicine. So, primarily, we take care of babies who are born premature. Some of my patients are born at 24 weeks of gestation, which is like 6 months of pregnancy. And some of them weigh a pound, which is like half a kilo.
Really?
And some of these families have gone through multiple pregnancies, not able to conceive, precious pregnancy. So there is a huge amount of satisfaction when you make a precious baby survive. And if you're good at what you do, that baby, that a pound baby or baby born at like 26 weeks of gestation, 24 weeks of gestation, if you give the best shot you could to a human being, that person later on may become the president of the United States, may become the biggest researcher the world has ever seen. So you'll never know. So that's what brought me or attracted me towards neonatal medicine.
To save the lives, that is
Absolutely.
so
Absolutely.
beautiful. But what are the chances of survival, if say like 26 weeks and you said like
In
a pound?
2025, the chance of survival at 24 weeks of gestation are probably about 70-75%. At 25, 26 weeks of gestation, almost like 90-95%. It's not the survival, but what kind of like life they're going to have later on is a bigger factor now. But as time progresses and as our understanding is improving, more and more babies are surviving and with a better quality of life too.
As you said, it's not just about the survival, but what about the organ development, especially the brain, or everything is fine inside the body?
Right. So again, at 24 weeks of gestation, some of them may have some developmental delays. But after like 26, 27 weeks of gestation, almost like 90%, 80 to 90% of the babies should be fine actually. It's really surprising. They may have a little bit of like problems here and there, like attention deficit hyperactive disorder like ADHD. They may lag a little bit behind in math and science kind of things. But in general, you would never know really. Yeah.
Your research on prolonged antibiotic treatment in premature infants has been groundbreaking. Could you summarize the key findings and their implications for neonatal care?
So that was my research project in my fellowship. That was one of the first research projects in that area. Previously, we used to give lots and lots of antibiotics to babies, thinking that basically babies don't have any immune system really, so they cannot fight off the infections by themselves. So we used to give a lot of antibiotics, but then gradually what we realized was antibiotics cause actually more harm than good. So basically they may treat infections, but babies are getting more harmful effects like later on in the life. So mine was one of the first 2 research papers published in that area. And I think right now my paper has got close to like 600, 700 citations. So that's one of the really breaking paper.
So how do you treat a little child with no immunity and fighting the infections?
So primarily, we reduce the duration of antibiotic use. Previously, we used to give antibiotics like lavishly, like 10 days, 15 days, 21 days. But now we are using like, if at all, we need to 2 days, 3 days. So kind of like minimizing the antibiotic usage.
You've emphasized the importance of NICU follow-up clinics. How do these clinics support both infants and their families after discharge?
So those are called NICU follow-up clinics, obviously. So the babies who go home or who are discharged from the NICU, sometimes they have like complex problems, like there are like different types of formulas. Some of them go home on oxygen. Some of them go home on like several different types of like medications. So for a general pediatrician, right now in our setup, they don't have that much time to look into each and every specific problem really.
Right.
In the 15 to 20 minutes time they have. So that's the reason why when these babies, when they're discharged from the NICU, the neonatologists of the NICU team have a better idea about these patients really. So it's only kind of like really pragmatic to bring those babies back to the NICU follow-up clinic to go over all these problems, to do the developmental assessment and all those things. So that's where the NICU follow-up clinics come into play.
Neonatal abstinence syndrome is a critical issue in newborn care. What are some key practices you found to be effective in managing this condition?
So we all know the opioid addiction is such a big problem in the States right now, even though there have been several attempts from the government to curb the problem. The big problem, what we are seeing in our field is when pregnant moms or women who have been taking opioid medications for a long time, those babies kind of like get used to that medication coming from mom. And when the baby is born, suddenly the supplies get cut off. So they kind of like behave like a withdrawal baby really. So it's kind of like a person who is on opioids completely going cold turkey. So the babies behave exactly like that. They're kind of like irritable, they want to eat, they cry all the time. So we kind of like, what we do is, there are several different methods of taking care of these babies, but sometimes we have to put them back on tiny dose of opioid medications and then gradually wean them off.
Your non-professional publications highlight significant social issues like infant mortality. How important is it for medical professionals to engage with the community beyond clinical care?
Is humongous. As medical professionals, actually, we have a bigger role to voice our concerns and going out into the community, going out into the public and advocate, and not only advocate, but kind of like explain the science behind what we're doing to the general public actually. Because the general public may not understand the scientific lingo and all those things. So it's our job to explain to the general public in simple terms what we're doing, why certain things have to be done in certain way. So it's kind of like a responsibility of all medical professionals, really.
What advice would you give to aspiring pediatricians or healthcare professionals interested in specializing in neonatal medicine?
Oh, come into NICU. If you're a pediatrician, come into NICU. It has got so many benefits. Most of the thing is you get the most job satisfaction out of NICU really. It's amazing feeling when a baby who is born at 24 weeks of gestation to a family who already lost like 3 or 4 pregnancies before, when that family gets to go home with that baby, you cannot beat that feeling. That's the reason why we are doing what we're doing. So yeah, if you're a pediatrician, NICU is the best specialty out there.
Talk about some new breakthrough. Let's hear about that.
So it's not related to the NICU really, but what I want to really talk today about is called stem cell treatment. So it's not my specialty, but it's everybody's specialty. It's like for some people or for some cancers like leukemia, lymphoma types of cancers, in addition to the regular chemotherapy and radiotherapy, they need stem cells. Stem cells are the cells which are produced by every human being. I have those, you have those, everybody has it. Those are the cells which have the potential to become any type of cell in the body. They can become like skin cell, they can become like intestinal cell, they can become like bone cells. So there's such an important types of cells in the body. So for example, if a cancer patient is there, all their cells are kind of like wiped off with the chemotherapy and radiotherapy, and then if those patients receive these stem cells, then those stem cells can produce whatever cells the body needs really. Unfortunately, stem cells cannot be produced in the lab. They have to be transfused, or they have to be gotten from another human being really. So unlike blood transfusion, stem cells are kind of ethnicity specific, meaning I'm B positive blood type. That means if a person, whoever is B positive, that person may be living in Africa, that person may be living in like Australia. If that person is B positive, I can give my blood to that person really without any problem. Or I can receive blood from that person without any problem. But stem cells are ethnicity specific, meaning Indians tend to match with Indians. So Indians may not get these stem cells from other races really.
But
they
why?
can get, but there is higher chance of matching with Indians. Here is a problem. The biggest problem what we're seeing is we don't have a lot of like Indian stem cell donor pool. That means there's a huge stem cell bank called NMDP, National Marrow Donor Program. It has got several like thousands of like donors registered. They haven't even donated their stem cells yet. They just like registered like, okay, if I need be, I will give my stem cells to a person, to a patient. So kind of like registered donors. Unfortunately, there are not a lot of like Indians registered as donors in there. The problem is a fact. I'm not lying really. Patients of Indian origin are actually dying, literally, because of lack of stem cells. So that's the reason.
So if you tell them like it's really easy, like it's like regular blood donation.
Absolutely.
Yeah.
So
it's not going to hurt. They're not going to
no,
cut you.
no, absolutely.
No incision.
Stem cells is like really donating stem cells is the easiest process. It's easier than like blood donation really. What happens is they take the blood out of the donor. If matches, not every donor doesn't have to give stem cells. The first step is you need to register as a donor. Once you register, your data is going to be in the registry, and then if a patient comes and then they run the patient's match with the donors, and then if somebody matches, then that person will get a call, hey, you matched with this patient, do you want to donate really? So if that person agrees, so the actual donation process is so simple. It's like blood transfusion really. You give blood, and then they filter the stem cells, and then they put everything else back into the donor. So basically, the donor is not losing anything except the stem cells. They're not losing the RBCs, they're not losing like hemoglobin, they're not losing any proteins, they're not losing anything really.
So you put the blood back into
blood back,
the donor?
yeah, absolutely, blood back.
You just take the stem cells.
Take the stem cells and then filter the stem cells.
How much blood do you take?
Like probably 300 to 400 ml.
Which is like 1 bottle, 2, 3, 4?
It's probably 1 bottle really.
Oh, that's it?
Yeah. Nobody is going to put the donor in danger to save another patient really. So they put the remaining blood back, and the donor, the human body is so amazing, the donor body will produce the stem cell back in no time. So basically the donor is not losing anything except saving a patient. The biggest problem to this is, even however easier it is, the biggest problem what we're seeing is there's not a lot of awareness
Yes, there
about
isn't.
this.
Like I used to think stem cells is something you can get only from the placenta, because I've seen that placenta, you donate it and then it gets cultivated, and
Right.
so I don't know if that was a scam or what.
No, it's not a scam, but there are like so many banks, like placental storage banks, banks and umbilical blood storage banks and all those things. But this is much, much easier. If you're going to store your like umbilical cord blood, then you have to keep paying them like yearly fees and all those things. But this is much simpler. If you are between 18 and 40 years of age, what you can do is you just need to register at the NMDP website. It's National Marrow Donor Program, nmdp.org. You just need to go there. You just need to punch in your like personal details. You'll get a cheek swab. You just need to swab your cheeks, send it back to the NMDP. It's as simple as that. It doesn't mean that you're going to donate the stem cells tomorrow. It doesn't mean that you're going to donate the stem cells in 10 years. You'll never know. You may get called tomorrow. You may get called in 10 years. You may never get a call at all. But the most important thing is we need to increase the number of donor pool in the NMDP website. That's
But
the
you
most
don't
important thing.
have something like somebody goes and donates the blood and there's a blood bank specially
No,
for...
it's not like that.
Okay.
No, it's not like that. You just need to provide your information and then send the cheek swab. They will type the cheek swab for the stem cells. That's called HLA typing. It's different from blood typing. And they type your cheek swab, and then they store that information in their bank, and then they match with a patient. If you match, then you may have to donate. That's not obligation at all. You'll get a call, you can decide.
So I
whether to
have all
donate or
these
not.
silly questions which, an average common person may have. So if somebody has got cancer, say blood cancer, and you take the stem cells, are you able to get the bad blood out of the patient and transfuse with the good blood, like
In a way-
cancer-free blood?
In a way, it's exactly like that actually, because the chemotherapy, what chemotherapy and radiotherapy do are, it kind of like wipes out
That's
the,
really
the
bad. It's like
patient's
poison,
cells.
right?
Absolutely. So the patient cells are wiped out, and then they inject these stem cells. Again, as we talked about, these stem cells have the potential to become any type of cells in the body. So that's what happens really. So kind of like in a way, you're kind of like plucking out all the weeds and putting in new seeds, which can germinate.
So it should be able to cure any type of cancer, even like GBM, which is like the worst, and the prognosis is really bad for that.
Yes, the doctors will decide, the cancer doctors will decide who will benefit from the stem cells and all those things. But the biggest problem, that's what I'm saying, is the biggest problem is there are not a lot of like Indian donors in the stem
I'd like
cell
to
in
sign
the
up.
bag. Absolutely. If you're between 18 and 40, please do.
Okay.
Please do. If you're between 18 and
Then
40.
I'll ask somebody else.
Right, yeah,
My
yeah,
neighbors.
please do. Every family who has got a kid between 18 and 40 years of age, please register. It's our like moral responsibility, because we don't know when cancer is going to hit anybody. Like it may hit me tomorrow, it may hit you day after tomorrow. We'll never know.
Yes.
Cancer is an academic topic until it actually knocks on our door. So
Very true.
the pathologic situation right now, what is happening is, once the patient is diagnosed with cancer, in addition to dealing with the cancer, they are doing all these, like they are having to run all these like stem cell drives to get donors and get the stem cells from them. Imagine what kind of burden that is putting on these like patients and families. So that's the reason why API, the American Association of Physicians of Indian Origin, partnered with NMDP and doing the first ever nationwide drive. Number one, to increase awareness. Number two, to recruit more and more donors, really.
Wonderful.
So this is the first ever nationwide drive or nationwide program we're doing among Indians to increase awareness and to increase the donor pool.
Wonderful.
So please cooperate. If you are between 18 and 40 years of age, if you are living in America, you don't have to be citizen of US, America, but you just need to be living in America. Please register as a donor.
Absolutely. Thank you so much, Dr. Sashi Kuppala, for sharing your valuable insights and experiences with us today. We appreciate the important work you do and look forward to seeing how your research continues to shape the future of neonatal medicine and, of course, the stem cell drive. Thank you so much.
Thank you for having me today.